Hey, this is Matthew from the SWYP 7-Minute Supersonic podcast. I'm here at the ADA at the Cellerant Best of Class Tech Expo. I'm here with Wayne from LED VELscope. Welcome.
Yes. Well, thank you very much. It's a pleasure to be here.
Aloha.
Aloha. It's a pleasure to be in Hawaii too. It's awesome.
Let's talk about this awesome product that does great things. Gives dentists superpowers.
It does. It helps them to see what they can't see. Exactly.
Right. So how important is that?
Well, I think one of the issues that we're having right now is oral cancer is increasing rather than decreasing. And one of the main factors in that is the human papilloma virus, specifically 16 and 18, which means it's become a sexually transmitted disease. So for clinicians, what does that mean? It means we need to be paying attention to all of our patients, not just our males over the age of 40, smokers and drinkers. Yeah, we got to pay attention to them.
Because that was the core, you know, when this product first came out, what, 10 years ago? I don't know when it was. Is that about right?
Yeah, well, actually 2006.
6, so 12. Yeah. Okay, the main audience was the typical, the smoker, the, you know, cancer, the 40, 50-year-old man. So that, I'm guessing that audience is maybe flat or declining, but the growing one is the younger audience that's got the HPV virus.
Right, sexually transmitted disease. So we need to be diligent, and you know, it's the hygienists and the dentists at the forefront of this.
Right.
And unfortunately, we haven't been doing as good a job as we should be doing. We're finding oral cancer late 70% of the time, with tragic outcomes. Patients going to lose part of their tongue, part of their jaw, not going to be able to speak the same, not going to be able to eat the same. Then after all that, 52% of the time they're going to die within 5 years.
Is that right?
But there is some good news.
All right.
If we find
I was hoping there was good news.
Exactly.
Jeez, you're bringing me down, Wayne. Let's talk happy times. We're in Hawaii.
80 to 90% curable when we find it early. And
how soon? When you say early, how soon do we need to find it?
Dysplasia. So dysplasia stage. So if we can find dysplasia stage, that's a home run for everybody involved. And really that's what the VELscope does. Right. It allows clinicians to see under the surface. The progression can be 5 to 7 years, and what we normally see is a leukoplakia, erythroplakia, but if we can find it early, home run. And it's an opportunistic screening. Our patients are in our office on a regular basis. Right. There's no reason for this to be happening.
No reason not to.
I know.
So it's so the product is super easy to use, right? I mean, you just turn it on, plug it in, point and shoot, right?
That's it. Well, it's adjunctive. So you do your standard oral cancer screening exam, palpation. Should take you no more than 2 minutes to use the VELscope. And when you see something problematic, it does jump out at you. Right.
And it transfers to my imaging software? How do I get to see what I'm seeing? Or is it just visually through the lens?
Well, normally it's visually through the lens. So we scope and we see something that we think is problematic. Then we have the ability to utilize our iPod Touch, which allows us to simply capture our images. It has a little application that allows us to identify the location of the lesion. Right. So we capture a VELscope image and a white light image, and we can put that in the patient's chart so we can compare later, or we can communicate that with the specialist, maybe doing the biopsy if we're not doing the biopsy, or you can send the images off to us, and we get them to Dr. Truelove at University of Washington. With the patient health history and lesion history, and we give you a consultation that's free of charge. So
that's included in your VELscope package, because I think that's probably one of the hesitations, right? There's lots of hesitations to why. First of all, no one likes to deliver bad news, right? Absolutely. No one. But I think we have got to get past that and say it's a responsibility of the clinician to at least do what they can, because they are in there every 6 months, you know. We got to do it.
Policemen and firemen save lives. We find oral cancer early, we're saving a life. And that's really, we're at the front of this.
Right. Is there a hesitation that they just don't know what they're looking for? Like, is there just that gray area that maybe I see something, maybe I don't? And that's where the consultation sort of gives them the confidence to be able to say, hey, I know what we're in for. And I can at least pass it off to somebody and say, hey, we can help.
Absolutely, that helps. But we have full training as well.
Right.
So we go through how to differentiate between trauma and something more serious. So it's pretty straightforward. I mean, what it does is give a clinician better information to make an informed decision on when to or when not to send a patient off for a biopsy. And there's a clinical study, 2,400 patient study, that shows specifically that. Gives you better information than white light.
Wow. So any idea what percentage of dentists are doing I mean, 100% are doing oral cancer,
Are they?
Well, you tell me. They're not.
So if I do a presentation and I have 250 people in the room and I ask them, hygienists and dentists, to put up their hand. Last time you were in for your annual oral exam, were you palpated, tongue out with a 2x2? Very seldom will I ever get more than half of the audience putting up their hand.
So you think
these know what they're doing.
Right. So half. So if we say only half are doing this, less than half are even using this technology then. So how do we, I mean, this is saving lives. This is a really important thing. How do we change the adoption rate to get people using it?
Well, I think what we try to do is we try to support our customers, but we've also invested very heavily in clinicals, because for a doctor to use this, they need to have the confidence that it works. So we have over 27 studies to date. We continue to invest in clinicals. We just completed a 5-year double-blinded study in Canada.
Right.
And again, what it showed was really interesting. It's a paper published in JAMA.
Okay.
They had a 39% reduction in reoccurrence if you cut the tumors out. These are the surgeons who see tumors every day.
Right.
If you cut them out with the VELscope, 39% reduction in reoccurrence versus white light. That changes the way surgery is done. And it also gives the dentist and the hygienist the confidence that this is really doing the job. You can't see what you can't see.
Yeah. So how many different technologies are there of oral cancer screening? Is it just one?
There's about 4 other technologies that are out there, but this is really...
What makes this one the best?
Well, it's easy to use. The light is bright enough to go all the way down into the epithelium and excite the cells. That's really important. And most of all, we have the clinical studies to support it, unlike any of the other products. So the other products can't be used for surgery. So I think clinical efficacy is the main reason, ease of use, and the ability to capture those images and share those images is pretty critical too.
I guess we may get to a point where the consumer actually says, hey doc, can you check me for oral cancer? I'm worried about it. How do we get to that point?
Well, that's, again, the public awareness campaign is huge. That is really what I think it does take. I think motivation by the patient, but also this is a differentiator for the practice. There is a fee code, so there's really no reason for a clinician not to use it. And the way I look at it is, we use loops to be able to see things better, but make sure we don't miss anything. Same with this. We don't want to miss that on one of our patients.
It's too important.
Absolutely.
This isn't like missing a crack in a tooth, right? I mean, which is bad, right? This takes it to another level.
Yes.
Well, cool. I think the VELscope is an awesome product, and I think it obviously solves it's not just a typical need. It's a really important one. It's a life or death one. Super important. Well, thanks. Thanks, Wayne, for joining us.
I appreciate it.
Yeah,
Thank you very much. It was a great program.
Excellent. Thank you. And that's it for the SWYP 7-Minute Supersonic podcast. Aloha.
Aloha.